fanboys. Father, there is a absolute. Okay, okay. The meaning is not absolute. Like that, we used to coordinate with each other. Earlier sessions, it was a discussion, but this is not happening in our session. So I would like to say the same thing and to be continued in this with this discussion classes. So everyone has joined. Reshma, everyone, please open your YouTube link and please give a like and subscribe it and do share with everybody so that it will reach to maximum number of OET aspirants. Please open your second device and just open your YouTube link and just give a like. Anu Sevin is here, and that Madhu Samjana is here. Good evening, Samjana. Samjana. You are muted, Sanjana.
Good evening,
Samjana.
brother.
Samjana, are you hearing me? You are again muted. Unmute yourself. Yes, and talk. In the Zoom, if you click on.
Good evening, Father. Good evening, everyone.
Good evening. Yes.
In the Zoom, if you click on.
Good evening, Father. Good evening, everyone.
Good evening. That means if you can find yesterday, whoever sent me in the admin panel, yesterday's listening audio, questions, and the script, if you can just forward again in the admin panel, I'll be grateful. Those who posted it may know it, right? That means, am I audible?
Yes, Father.
Yeah. If you those who have pasted it will be able to find it. I couldn't find it immediately. Just wanted. Okay. Not what we did yesterday, but the whole question, though ABC full was their audio. Yeah. And good evening. Hit the chat rate and keep smiling. Ganesh, there's no smile on your face. Yes. All right. Yeah. 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 If you're ready, you can begin, I believe.
Okay. I want to try the video sharing, but I can't see any icons in my Zoom. I don't know what happened. Just now it was there. I start sharing like that. I click over that. Now I can't see anything. Cannot leave. Also they cannot unmute. Nothing. I think it's because of the network.
Good evening to all.
Yeah, good evening. Elizabeth, you can just exit and enter again. It will be cool.
I can't see the leave button also.
And the
Maybe full
button.
screen. It is in maybe full screen.
Just tap the screen, then you will get. Just double tap your screen.
She has left from the conversation. And Prabha, please change your device name. One place not N20 SE to Prabhavati Debarma. So it will be easy for us to admit you into the session. Kindly exit and re-enter if possible, since the session is not started.
Okay, I'll do it.
Those who have the numbers, even you can have their numbers as well. Along
Yes,
with
Father.
your first name, if you can add your Edu number, that will be cool. So
We have been assigned a
Okay.
few numbers, EDU numbers. So you
I
better
think
you
today
place. Yeah.
we can share in the special batch because we just finished our discussion batch, right? So we may share by today to the discussion batch. Sorry, the special batch first. Then we think about next. Can I try one time the share the PPT?
Sure. Right.
Oh, thing need to make me host co-host.
Just reminder for all the aspirants, you need to keep 3 diaries. One is for synonymous language. Other one is 3 diaries. What are the 3 diaries father used to say? Paraphrasing. Another one?
Synonyms and synonyms language.
Synonyms and synonyms language.
Then paraphrasing. Another one? Vocabulary. Vocabulary related also we need to. Okay, Elizabeth, we can able to see this.
Visible?
Try
Is it
to
visible?
rotate it. Try to rotate it so that we can able to. Yeah. Okay.
Okay. Is it like that? Okay.
Now it becomes small. Just rotate again. Back.
Okay.
Yes. Done. Yes.
Okay. Am I need to go to under the last slide?
No. Not required. Actually, we are able.
Okay.
So first, who is the first
Okay.
one? First, going to discuss Sultana. Ask her. You are coordinating, right, Elizabeth?
No, Varsha coordinating.
Varsha.
Varsha is there. Yeah.
Varsha, you have to summarize everything. What once they had a session, once they had discussion, whatever the slides are completed, you have to summarize the entire thing so that the aspirants will summarize themselves and they will write. Like me, we don't have any other options. So please, done. Okay, Father, we need to. We are starting, Father. Yes.
Recording.
You can start reading the task. Yes.
Ganesh, recorded. Recording started.
Yeah, already. It not started. Yeah.
Hello, good evening, Father, and good evening all. I'm Varsha, one of the OET aspirants in this group. Today I'm going to coordinate this session, and I would like to thank Father Sarin Joseph and all admin members for giving me this opportunity to present. Before moving ahead to session, we will do a minute prayer. We can close your eyes. Okay. Now, we will start our session. Initially, I would like to call upon
See the screen, Varsha. It is there, episode 30.
Yes. Yeah. I would like to call to Sultana to present episode number 34. Hello, Sultana. Hello. Sultana is there?
Yes, ma'am.
Yeah.
Good evening, everyone.
Good evening.
Please start, Sultana. Next slide, please. Sultana, this is your PPT. Please present.
Okay, okay.
Yes, sir.
You will show the slide or just
We will
Yeah,
show
this
you.
slide.
We'll show you the slides.
okay, okay, okay. Okay.
Okay. All the best, Sultana. I think she bit nervous first day. Don't worry, we are here. Okay.
Okay. Good evening, everyone. First of all, I would like to thank God for giving me the strength and opportunity to stand here today. And secondly, I would also like to thank the Father and the all administration members for giving me this opportunity. I am the one of aspirant. My name is Sultana, and today I am going to explain an OET Reading Part C, name-based question, and the strategies used to answer it correctly. Please, could you show the slide?
Is it
Showing the slide.
Yeah. This is the reading part C,
Yeah,
question number 14. There is a Dr. Suter suggest. First of all, we will, when the name-based question come, we will highlight the Dr. Suter suggest. And there is written that the rise in cases of one allergy may be partly due to means there is a reason. So Dr. Suter is suggesting that there is a one reason why there is a allergy coming to people. Option A is written here, attempt to improve eating habits. So we will highlight the improve eating habits. And second option is written changes in the food manufacturing method. So we will highlight the manufacturing method. And option C is the written adoption of new agriculture practice. So we will highlight the agriculture practice. Fourth one, increase level of harmful substance in the atmosphere. So also we will highlight the atmosphere. So this is our way in how to highlight the key hedging words in the options. Then we will go to the text. If there is a name-based question like father strategies, immediately we sweep down to the name in the text, search name in the paragraph, or maybe a organization or any device. So first of all, we will go the paragraph.
Screen not visible, Elizabeth. Screen not visible.
Once you stop and try to share again.
Is it okay?
Elizabeth.
Yeah, now it's fine.
I
Yeah,
can-
okay. Now okay. Again go.
Okay. Okay. Is it okay?
No.
Yes,
Yeah, now
yes.
okay. Yeah.
Next slide.
Yeah, this is the second one.
Yeah.
So then when we'll go to the paragraph, we will highlight here some doctors and then second, some experts, and there is a written third one paragraph, Dr. Suitors. So here there is a three peoples, or they present their opinion. So first of all, there is written here doctors. Second paragraph, there is some experts, and third one is Dr. Suitors. So our question is about Dr. Suitor. So we will go after the Dr. Suitor. What is telling the diet conscious population is increasingly turning to nuts as a source of healthy fats. So this is our answer from the Dr. Suitor. So we can see here from the plural, there is a plural from some doctors, plural from some experts, but Dr. Suitors has a singular word. So our aim is to search the answer from the Dr. Suitor. So we find out here the diet conscious people is increasingly turning to nuts as a source of healthy fat. So we can find here our answer, and then we will go to the options. Third one, please. Next.
Elizabeth, next slide.
Yes.
I think it is stuck.
Is it visible? It's already number, yeah. Yeah. Is it number? Ganesh, can you hear me?
Yeah, I'm doing it. Elizabeth.
Yeah,
Okay,
it is
okay.
visible now.
It started heavy rain here. Yeah.
So here, Dr. Suitor is suggesting that the last line of the paragraph, there is written a diet conscious population. So this is our answer is from here. So we will go to the option, and we will see which option is matching with this line. So first option is telling improve eating habits. Second is manufacturing method, and third one is agriculture practice, and fourth one is atmosphere. So Dr. Suitor is telling diet conscious population, increasingly turning to nuts as a source of healthy fats. Option A is our answer, because they had written is attempts to improve eating habits. So people, they are improving their eating habits. Next one, please. So name-based question is very easy to find the answer, because directly we can go to the name like Dr. Suitor. So this option A is our answer. I hope you understand.
Yes, yes.
Okay,
Yes,
thank you very much
thank
to listening to my presentation. I'm sorry if anything
Thank you,
I
Suparna.
say
You've done
something
well.
It's okay. It's
not
okay.
good.
It's fine.
Yeah,
It's
you
doing
have
well.
done well.
Yeah.
Okay, Sultana, I would like to just recap about the sessions you have done. You present the name-based questions, and you
Yeah,
explain about the name strategies used in the questions. you explain regarding how to mark the hedging words if there is a name in the question stem, and how to locate the answer, in the text. You explain well. Also, you explain regarding the how to mark the hedging words in the answer options, and how to correlate the answer option with the paragraph. And you explain regarding the singular versus plural, and that suggest the opinion based shown in the questions, and answer in the answer option that there is a speculate word that is a synonymous to the suggest, so we can get the idea how to locate the answer in after the name of the particular person in the text. And due to also the reason, means we have to find the reasons about the question. So you explain well about this, and thank you for that.
Thank you so
And
much.
now I would like to call to the Anu Sebin to present the episode number 35, and the question number is the 15. So welcome, Anu.
Yeah, thank you. Good evening, everyone. My name is Anu. I'm one of the OET aspirants from EduSkills International. First of all, thank you for the Salim Joseph and admin panel for giving this opportunity. So here I'm going to deal with question number 15, episode 35. So today we are dealing with reading part C. Could you move the slide? Yeah. So today we are dealing with name-based question. So if there is a name in the question stem, what we will do? Anybody can reply that?
So we can go to the text where the name
Yes.
is.
Yes, well done.
It's
Yeah.
given in the
So
Paragraph and
text.
find the
The
name.
questions.
We have to
yes,
drop
of
down
course.
the names
So it
in
is
the
a
text.
clue based, for finding the answers.
Yeah, yes, that's correct. So we spoke on the test where the name present, so we can find the answer. So could you please go to next slide? Yes, and if maybe the in the test maybe there is an organization, person, device, or whatever. So whenever that we all know if there any name present in the test, we immediately go to the name in the test. So let's read the question. Question 15. In the first paragraph is suggested that Dr. Logo feels. So Dr. Logo, that's the important one. That is the person name. And we can mark the hedging words at Dr. Logo. And okay, feels means his emotion. So let's see the answer options. His emotion, first one, A, annoyed, B, concerned, C, surprised, and D, frustrated. So this 4 is the emotion what we can see in that question stem. So could you please go to next slide? Okay. In this test, we can see that Dr. Frank Logo, because before that name, this is a subject complement. So we can eliminate that. We don't want to read that one because it's a subject complement. So we can strike it off. After that is written that how the Frank Logo knows how destructive Alzheimer's can be. So destructive meaning is how frustrated. So we can see that answer D is the correct one because he's saying that how frustrated. Sorry for that. Sorry for that.
Okay.
So yeah. So we can see that answer option D is the answer. And so sorry for that. So like my children's are a bit, so I can continue tomorrow. So like I find the answer. So I think you all watched the video. Sorry for that. Is that okay?
Okay. Can I continue with
Hello?
this?
Elizabeth?
Hello, Reshma.
Hello. Reshma, are you okay to continue?
Yeah,
She said,
I want to try.
Yeah, just try.
Can I start?
Yeah, you can start. Yeah. It's already, we
Okay.
identify the hedging words. Yeah, you can just do. I
Yeah.
think the third slide is
So,
enough.
as per, yes, ma'am, I'll try to do. Um, Okay. We already the hedging words here. Hedging words means important keywords. So in this question, we have to identify the what Dr. Logo is feeling about it. And Anu has already explained that he is feeling distracted. He is feeling distracted means what? Frustrated. So answer D, option D can be the our instant answer, but I want to give more explanation on that. Okay. See the last lines. Okay, first option. Annoyed that certain Alzheimer treatments are not approved for the human use. This sentence regarding to the human use, it is not there in the paragraph. So we will cut that option. Okay. Now, option B. Concerned that the Alzheimer drug LM11A3 may approve the ineffective. It is a straight away opposite what last line of para is saying. Okay, in last line of para it is saying it is the most critical part of finally making that can happen. Okay, in this line we can make out that it is saying it is very effective. Okay, that a drug is very effective according to the para, but according to the option it is saying opposite. That's why the option B is also gone from the answer list. Third option, that is surprise that so little is known about what causes Alzheimer, and this is also not appropriate according to the content of the paragraph. That's why it is gone. And frustrated by the lack of progress towards the treating Alzheimer. Okay, so here we can go straight away to the name, as it is saying that as logo says, we cured Alzheimer's in mice in many ways. We can't move that success to the many people. So this feels that he's feeling frustrated. There is no progress in the Alzheimer treatment. So this is the suggestive of option D. Is it correct? What I explained?
Yeah, exactly. Correct.
So you can see the contrast word over there. You can find the answers there. Then the first option you
Yeah.
already explained. Yeah, it's fine.
We can find the contrast
yeah,
word after but, right?
and the last
But
portion,
plus wait.
but is the first one.
First
But
is
if you have the name repeated in the paragraph, we need to look for the second name, the last portion, last part of the name. Then we can see the however also there.
However, so
Then
but
we see the
after that, however, but the answer is not there, right? His new drug code LM1131 could be a critical part of finally making that happen. So it meant to be that B, right? It's opposite to B, isn't it?
Yes, opposite. Yeah, we can eliminate.
Yeah.
Then the first, this is the, yeah, it's fine. Yeah, that's all right. Yeah. Any doubt? I think we can continue with the next question.
I have one concern.
Anything else you want to add on?
Excuse me. Can you go for the? Oh yeah, that's fine. like if the contrast word is there in the text, so like the first is a contrast word and second is a contrast word. So like how many contrast word, I mean, like if you find the answer, it meant to be the first contrast word or the second contrast word. So we need to focus that. Any idea about that?
According to the strategy, we need to look for the second,
second,
Second one,
option.
right?
Yes, second.
Yeah, second, but the second one is that like the however, right? And the last one, yeah, if ongoing trials continue to grow, I mean to go the way he hopes, but that is this the text is opposite to the B one, right?
Opposite. Yeah, drugs at me.
Yeah.
I can't see.
Yeah. So maybe
There.
it is like
I'll
exceptional cases, right?
give you
Sorry for interruption.
Shash.
Yeah.
It is
Shash.
saying there is still no. One minute.
Shash.
There is, we have cured
Shash.
Alzheimer's in mice many times.
Shash. Are you
Yeah.
here?
Yeah.
It
Yeah.
means this
Audible.
drug is used for
Simple as that.
mice.
Dr. Longo feels. We have to swoop down to the name. Okay. Once you identify the name, you should go with the only whatever is comes after that. Okay. And there is no certain things like after identifying the name of the whoever it is, doctor, scientist, or researcher, whoever it is. Then after following his name, it might be repeated sometimes. It might be Dr. Longo, Dr. Frank Longo, Dr. Longo, like that. It may be repeated. But if you see here in the first contrast word after the but, Frank Longo knows how destructive Alzheimer's can be. That this was discovered in 1906. But despite more than a century of research, including the testing of over 200 new drugs in the past 2 decades, comma, there are still no real treatments, as Longo says. Again, as Longo says, we have cured Alzheimer's in mice many times. Why can't we move the success to people? See this highlighted words, destructive. Again, there are no still real treatments. And again, why can't we move the success which are happening in the mice? Why don't we move this success to the humans? So these all three are concern related to frustrated. So you cannot say that it is second word, first word, whatever.
No,
The gist.
I got it. No. I just ask you. This one.
Okay,
There
yeah.
are still no real treatments, right? And you can see that the full stop. So and as Longo says, is the other sentence, isn't it? As Longo says,
That
is the
second
other
contrast.
sentence.
Yeah, but that second after second
No,
contrast
once we
word.
have the once we have the name, we can ignore the rest. Yeah, ignore the other
If we have
strategies.
ignore the other things. No need to go to contrast word, this and that. If there are names, you go to the second name, and whatever the second name says, that will be the answer most of the time. And you need not go for any contrast or this or that, because once name is found out, that's it. You have to go with the name. That is the strategy here. Understood, Shah?
Yeah.
If it was without name, then you're right. You can go to the second contrast word. But your main keyword is the name-based question. So we have to just go to the name, and that too second time when it is repeated, most of the time the answer will be in the second name mentioned. That's it. Kindly don't get confused.
No.
If you
I'm
have
not confusing. I'm not confused that the as Longo says, the second name is there, right? So
the answer is there, right?
the previously there are still no real treatments, okay, and full stop.
Yes.
So
Yes.
after the full stop, the as Longo says like that. So yeah, just a bit, just
See, Longo
Sometimes I
says
would
what?
like to
You have
add some.
cured Alzheimer's in my times. Why can't we move that success to people? Is saying that means what? The Longo is really frustrated that he is not able to do the success to the people. That itself says that he is frustrated. We need not go to anywhere else. That itself says the answer, isn't it? Am I right?
Yeah.
Yes, ma'am.
It's
And
not.
Shash.
yeah, tell me.
So you go to second contrast Raven. However, if ongoing trials continue to go to the way he hopes, his new drug called LM11A31 could be a critical part of finally making that happen. Is this matching with any answer option?
No, yeah, it's opposite. I got it.
Yeah.
I got it. I just
Yeah,
cleared
you
about
have to
that.
see,
I cleared about that.
you
So yeah,
feel
that's fine.
you have to see the texture, color, everything of the text. Then only we have to come to a conclusion. But sometimes some strategies works out for all, but not all strategies would work for this contrast word option.
Yeah, once name is there, the
When the
rest
name
of
is
the
there,
all strategies we can, yeah.
then
Name
the
is
rest of the rest of the strategies we should avoid. That's it.
And as per the question, we will see the logo fields, means we will see the emotions first, and the doctor emotions. So we will give the importance to the emotions. So it shows that it knows how destructive, and other things are illustrated about the how destructive. Why he is saying the destructive. So the main thing is the destructive is related to frustration he is showing, and other all things where he feels the frustration, still no air treatment, or there is no move to the instructor to the people. So that is the illustration of the destructive, why he feels. I hope I am understanding that.
And one more thing, if there is name, kindly go to the name. Rest all you can ignore, the rest all strategies. You can directly go to the name. If there is second name, most of the time, the second time when the name is mentioned, the answer will be there according to father. We can clarify with father also later once we finish our session. We'll continue now because
I think it's enough. Yeah, we continue. Yeah, let's continue with the next one.
Yeah, thank you, Reshma and Anu. Now I would like to call to Sash for the question number 9, episode number 35. Welcome, Sash.
Yeah, thank you. Good evening. I'm Sash Anthony. I'm an OET aspirant from EduSkills family. And first, initially, I would like to thank you for the Salim Joseph and other admin panel members allow me to explain the question number 9th one, episode 35. So can you go for the slide, please? Yeah. So in the third paragraph, we learned that Reg Malling developed the POSM T2. So can someone shout which strategies so we are apply here, please?
Name.
Name and abbreviation.
Yeah, the name strategies.
Abbreviation.
And what
Abbreviation.
type of method we are using? Is a QAT or QTA?
QAT.
Second?
QAT. Question, answer,
QAT.
and text.
I think it's a QTA, right?
If there are
and
four
QTA.
options,
Text answer, right?
there are four
QTA.
options. QTA.
QTA method. Okay. So can we go to the slide? The slide, please. Text. Yeah. So someone is saying that, it is saying it is regarding the name-based question. So we need to soup down the name in the text. So we can find that in the question statement. Reg Malling is a name, and it is other name is that POSM. It is
Sash, you have muted.
You are mute.
Sorry for that. Okay, so here the question statement is saying that in the third paragraph, we learned that Reg Malling developed the POSM. So in the text, so we need to find the same name in the text. So as I said, it is a name-based question. And if there is a name in the text, the answer should be there. See, we can check for the name in the text. POSM was developed by the Reg Malling, a volunteer at a hospital for paralyzed people, after he discovered that patients at hospital who had lost the use of their voice were only able to communicate using a bell. So answer is almost here. So we know that already says name-based question. So immediately we soup down the name in the text. So answer A option is saying that the number of people who had permanently lost their voice. So is there anything regarding the number of people in the text? Only mentioned that who had lost the use of their voice. So it is not mentioned anything regarding the number of people. So we can eliminate the A option. And the B is the lack of accessibility in previous SIP and PUF designs. So in the text, so we can see that in the first one, a typewriter operated through an air pipe known as a SIP and PUF typewriter, the first electrical communication device for disabled people. It is mentioned something regarding that one, but sorry, it is not mentioned anything regarding the lack of accessibility. So there is mentioned that it's accessible, like it is a first electrical communication, like that they say that. So I think it is opposite. And the C option saying that limited communication options for disabled people. So we can, the answer is the C one. So we can find the answer like the middle of the text. We can see Ragmaling, a volunteer at a hospital for paralyzed people. Like we can see that the comma is there. So we can eliminate it is a subject complement as per the further strategy. And after that, after he discovered that patients at a hospital who had lost the use of their voice were only able to communicate using a bell. So the same thing, it is clearly mentioned, the C option. It is paraphrased. Only is meant to be limited. Communication option is that communicating using a bell, and disabled people is that who had lost the use of their voice. It is my understanding. I'm saying that. Okay, if anything I'm wrong, just please tell me. Okay. And here the question statement, we can see that can someone say that in which voice are they asking? Like, is it active voice or passive voice in the question statement?
Passive.
Question statement is saying that active voice, and text statement is saying that passive voice.
Passive voice.
Yeah,
Text in the
so I
passive
think
voice.
they will confuse us to make confusing the whole thing. So we need to be aware about that. And I need to explain the last options. The D option, recent development of similar sound technology. It is not anything mentioned regarding the sound technology. So in the last, it's not last, in the middle of the paragraph is saying that these technologies were gradually developed like that. So it's not mentioned anything regarding the sound technology. So see, the last option is we can eliminate. And the C is the correct one. And I hope I had cleared all your confusions regarding these questions. So thank you very much for this. And okay, thank you very much.
Thank you, sir. Thank you, sir. Well explained. And clearly explained about the questions and question stem and how to find out the hedging words, as well as how to locate the abbreviation in the question as well as the text. And you explained well regarding the passive voice and active voice. Active voice in the paragraph and passive active voice in the answer question and passive voice in the paragraph. So and how to locate the answer by using the paraphrasing words like only against the limited in the answer options. And I hope it's explained well and understand everyone. Thank you, sir. I would like to give the session hand over to the father. Thank you.
Over to Elizabeth.
Yeah, I just want to add on the last slide one. If we follow fathers, am I audible? I have some network issue.
Yes.
Okay.
Yes, ma'am.
If we follow the step-by-step learning, we can understand the last question. It's asking, the question is asking for the due to. It's a cause and effect language we can see. Once we swoop down to the name, we no need to think about anything. Just see what is the reason he is telling, why he found that POS machine. Once we follow the step-by-step learning videos, definitely we can crack the time immediately. It's like because here this video father explained the name based concentrate on the name. That's why he didn't mention anything about the cause and effect. But we follow if we follow the basic things, definitely we can correlate the things. Okay, here is the name is mentioned, the abbreviation is there. Okay, the question is asking about the reason. So let's see the reason why they are asking what is the cause. Okay, yeah, so like we can think immediately. Then we no need to be waste much time. So that's my just need to be follow the step videos 1 to 40. That's the important, so we don't miss that. If anybody is still newbies, you can go through and watch it and make notes and post in your our main platform. Then only we can thorough that the basic things. Yeah, I hope that's all. Anything else?
Yeah, that's fine.
Yeah, Elizabeth,
The
I wanted
previous
to
question,
add
right?
that.
The previous question answer is that C. Can someone upload the slide, please? Just I need to raise a concerns regarding this one. C option. The previous question.
Is it the one you explained?
Yeah. It's the one I explained. Yeah, just please.
Ash? Which one, Shash?
The ninth question.
Sash explain.
I explained that one. The Ragmaling developed
Okay.
the POSM. Yeah, please. Has anyone, in this C option, anyone focus that one? The limited, it meant to be 0, right? As per the father strategy, 0 like that, right?
Limited.
No, limited means
Limited is not 0.
no. Limited means the question, then the text it is what saying only able to communication using a bell. Okay, only that a bell only they can. That is the limited. That's why the communication option is for disabled people. Only they can communicate with the using the bell. Normally the other people they can in the not text. Normally in the other people they can more option is there. But in the text saying only able to communicate using a bell. Only that one bell only they can use. That is the meaning. The paraphrasing the
Sash,
same.
it cannot be 0 because they're using a bell, isn't it? That means they're using some method to communicate, not 0. Are you getting the
One
point?
method is there.
Yeah.
One method is which one? Using a bell. That means they're using some method, not 0 method. By using a bell, that is the way they are communicating. That means they're using something to communicate, not 0, according to me.
Yeah, less options for the communication.
Yeah, that limited one is not enough. That's why he create the POSM. That's the reason. Okay.
Limited means there are they are using a method, but not to a fully extended method. Like not all the communication. There are very many various ways of communication, isn't it? Like hand action, like speaking, like writing. All these are communication methods, but they are using in that only limited. What limited? By using a bell, or maybe by writing. So they are using a communication method. It is not nil. Are you getting my point, Sash?
I got it.
Any other doubts? Shall we move to further? Then we will get the
we can go.
wonderful session. Yeah.
Yes. Congratulations, you did well. Great job.
Thank
Thank
you,
you.
Yeah.
Father.
Anything left out to consult with me? Anyone who's not convinced, you can raise any concerns.
Hello,
More
Father.
the doubts, better the learning.
Hello, Father. Reshma here.
Yes.
Father, I want to know about concept of active voice and passive voice. Matlab, my grammar is not so good. So,
Yeah.
what are those?
But maybe for your English you can know, but for OET you don't require. You don't require
Okay.
active voice and passive voice. Knowledge about active voice and passive voice is not at all required. That is not being assessed in OET at all. No way.
Yeah, in previous question, when Sash explained, he's used active voice. I don't know about this. What are active voice? What are passive voice? Anything is there
Father,
where I
shall
can
I
improve
explain
on
in
it?
Hindi? Reshma,
Yeah.
you want it in Hindi?
Yeah, no problem.
Yeah, Hindi, if I would tell you, like, अब जो हो रहा है अभी जो हम कर रहे हैं, अब मैं आपसे बात कर रही हूँ, वो
Jyoti,
active है.
excuse me, Jyoti. See,
Yes,
all
Father.
must keep your phone somewhere stable and sit properly, okay? Because it irritates others when it shakes. Okay? Always keep the phone somewhere stable. Don't hold it in your hand. That what happens,
Yes,
for the
Father.
listeners, if I feel it irritating when it shakes, leave the hand from the phone. Keep it somewhere with the help of a book or something if you don't have a stand. Yeah, take
Okay,
time now.
Father.
Yeah, take time now.
Yeah.
Yeah, because always see that everyone who is participating here, please look at that. There's a basic mannerism and respect for the listeners. Okay.
Okay, Father. Sorry, Father.
Yeah, it's okay. No, even yesterday I stressed it, and see that you sit inside the frame. So otherwise, your mouth is seen. Not only you, there are many people doing it. That's why I reminded. Are you okay?
Yes, Father. Shall I explain, Father?
Yes, yeah.
हाँ, ठीक है. जो अब मैं आपसे बात कर रही हूँ अभी, तो वो हो गया एक्टिव वॉइस. ठीक है, अभी जो हो रहा है. पैसिव का मतलब पहले हुआ, जब कल फादर हमको एक्सप्लेन किया कुछ रीडिंग के बारे में, लिसनिंग के बारे में, तो वो पास्ट हो गया, कल की
Past
बात है.
tense.
Excuse me. Now, actually, we don't require an explanation for active voice and passive voice. It will be confusing others. Okay, because that's not required. That's not being assessed in OET. You can join the general English batch if you want to have general English. That will confuse the people and they will keep asking now what is active voice, what is passive voice. That's never being assessed in any of the subtests in OET. Not even in your writing. Okay. And if you come across something, you can, or if you want to, because if you explain it, again, it's going to, you see, there are 12 tenses. You use maximum 4 tenses in your writing. So you need not learn all the 12. It's good to learn, but then those who basically find it very challenging will be having more additional burden learning 12 tenses. Just 3 to 4 tenses is enough. So we will restrict ourselves. Then those who want extra additional information can get into general English batch, not OET, or additional general English, because that will confuse other people. Okay. So we will not get into that discussion now. If you have discussed something and you saw in one text, you can just show me the text. I can clarify what it is. Was it discussed as a strategy?
Yes, sir. Yes, sir.
Yesterday, regmaling, that POS.
Yeah, just show me. Just show me. And Ganesh, can you show me the screen?
Okay, Father.
Okay. What was the explanation? Sash did it, right?
Yes.
On what context? What did you mean by active voice and passive voice? Can you just tell me?
Active voice is like that. the text.
Now,
The text.
why that came in this context? That's what I want to know.
Why?
Just to know how do you get it?
Actually, your father explained in that video, the active voice and
Active
passive
voice and passive voice?
Yeah, explain in that video.
Where is it? Where is it? Where is it?
Regmaling developed
Regmaling. See, we can see that regmaling is there in the question statement. Regmaling developed the POSM. It is active voice, and text is saying that was developed by regmaling.
Okay. Do you require that knowledge of active voice and passive voice to find the meaning?
No. It's the same meaning. Like
the question in the third, that is same meaning, but
Yeah.
in the third paragraph, we learn that regmaling developed the POSM due to. Due to means the reason.
Reason.
Okay. So, POSM was developed by regmaling. Does it mean that you don't understand regmaling developed the POSM and POSM was developed by regmaling? You don't understand that meaning?
I understand. I understand.
No,
Understood,
others who are
okay.
finding it.
No, understood, Father.
The simple question is, regmaling developed the POSM. POSM was developed by regmaling. They understand that is same.
Same, Father.
The sweet was eaten by Reshma. Reshma ate the sweets. Same, right? Yeah. So here why I'm not getting into active voice and passive voice, because beginners will find it very confusing, and that's not required.
Yes.
That's not a what you call strategy or tip here. Here the tip is due to. What is the reason? Why did he develop? The question is, in the third paragraph, why did regmaling develop POSM? Due to means reason, right?
Reason.
Yeah.
Yes, Father.
Yeah.
Yes,
So
Father.
option C, those answers you got right, only able to communicate using a bell. The limited communication option for disabled people. That is a paraphrasing. The limited communication means
Only able to communicate.
Only able to communicate.
using a bell. Limited communication means here use of bell. That's the only way to communicate. Okay.
Got it, Father.
Okay, cool. So what I'm saying, maybe I have said this is the same meaning, but I think anybody can understand that regmaling developed the POSM and POSM was developed by regmaling. That basic knowledge.
Correct.
So we don't go into active voice and passive voice. What does it mean? All those things. Only thing they are put in active voice and passive voice. I might have just pointed it out, but you don't require that as a strategy or tip to answer this question. The question is asking due to means reason. Cool.
Okay, Father. Thank you,
Yes,
Father.
Welcome. Yes. Yeah, you can stop sharing. So shall we go into a challenge today?
Acha, before
Yes.
going
Yes,
to,
Father.
I need to
Yes.
ask one question. Acha.
Yes.
Yes,
Acha, limited. Is there any other meaning, like two meaning, zero or like is it
Limited means not zero. Limited means some.
some, right? Yeah.
Synonym is some. There are some options, but not many options. See, now I have to communicate to you. Now the people at Zoom classroom can communicate to me in different ways. For example, you can chat, you can speak, you can smile, you can tell me all those things. But whereas at YouTube, those who are attending at YouTube streaming, live streaming, they have limited option to communicate with me. What is the limited option there? Only the comment space.
Comment chatting. Yeah.
Chat in the comment space. That is a limited option. That doesn't mean zero. They have some option, but not as many options as those who are in Zoom classroom. Okay.
Yeah.
Zoom classroom can pull down their face and make me stop my class, showing that they are tired, exhausted. But YouTube people cannot do that. I can't see them. Okay. Zoom people can, Zoom classroom learners can smile and communicate energy and make me continue. So if I continue longer, those at the YouTube live stream can comment that those who are at Zoom classroom must have a bad face so that father stops. Okay. So limited means some. Yeah.
Okay, sir. Okay.
Only bell is ringing the bell is the only way of communicating. Okay.
Okay.
Is that clear?
Okay, sir. Thank you. Thank you.
Yes. Now, you ready? Take 1 or 2 minutes break. Have some snacks, juice or something. I'll try to be short as possible, so I may not get into reading. In connection with yesterday's, we will give you a challenge listening and practice that a bit. Okay. The second extract from the same reading. By the meantime, you can have some snacks, juice, whatever you want to, so that you have some energy. And those who already have at your hand, you can pick the chat thread, this one chat box at YouTube live stream. Okay. Yes. 2 minutes break for others to reach. Yeah. Have something. Okay. Always see that you have something at your in your table when you attend the sessions, so that you can enjoy some nuts, some sweets, chocolates, or some juice or tea or coffee. Thank you, Ganesh, for your super chat. Yes. Earlier I saw some super chat. I don't remember if you have that deep. Messages. Yeah, you can also, by the meantime, get a super chat. If you any other comment space in YouTube live stream, you can just hit that dollar button. It starts from ₹10, Indian ₹10. Yeah. It helps us to reach more people. Yeah. And also it supports the mission. So those who have not tried can try. When you have a super chat, you have crown with your name. And Lini Verghese and Chandravadini, you can see their names in green color because they are the registered members of the platform. Yes. And also they have a star in front of their name. Yes. Keep chatting until others reach. It's 2 minutes break. You can also ask me questions, or you can type in the comment space if you have any clarifications required, or if you need something about listening or reading to be included in today's session. We're back, ready?
Yes, Father.
Today we will take you one step forward in the challenge. Yesterday I gave you the questions, right? Okay.
Yes.
Ready for your listening practice?
Yes, Father.
So once again, welcome to Edu Skills. So it made easy. If you're watching this on YouTube, kindly consider subscribing channel. Give us a thumbs up if you like our work, and share the link to your contacts so that we reach out to maximum number of OET aspirants. Please, at YouTube, if you have not clicked the like button, see that now you click it, and show us that you love our mission, and also subscribe. And you can also get a super chat. Thank you all those who have got super chat. Ramanjan, yes, and yeah, Lenny Verghese, yeah, Ganesh, yes. Yeah, did I miss any name? Super chats. All those rounds you see, they have the super chats, yes. And you can increase the number of crowns, the number you find there with a lot more of chats in the YouTube comment space. Yes. Let's enjoy the listening. Okay, we are taking second extract from yesterday. Share sound. Okay, let me know if you can see my screen. Okay, I'm sharing my screen. Is the screen visible?
Yes, Father.
Yeah. Yes. Now take your notebook and a pen or pencil. It's always better if you are taking a test on paper. Always try to accustom yourself by writing pencil, using the pencil. That too, the normal pencil, 2B pencil, not the pen pencil. Pen pencil will not be allowed in the examination hall, so that you get the speed to write your letter and other things. Yeah. Now, what you have to do, yesterday I gave you the questions, you remember?
Yes.
Yesterday I gave you these questions in the beginning, like many questions. Now you have to write down only the questions. Okay? Right, put number 1, 2, 3, 4. I will start in between. After the questions, I will try to stop. Do you understand? Listening from this audio, this is the second extract. Yesterday we have done the first one. Yesterday I gave you the questions. Today this is analytical listening practice. You write down the questions asked by the specialist here. Okay?
Yes, Father.
Ready?
Father. Yeah.
Let me know if you can't
Extract
hear.
2, questions 13 to 24.
It's audible, right?
Yes.
Yes, Father.
Yeah. Yeah, write down the questions. Questions asked to the patient, okay?
You hear a GP talking to a new patient called Mike Royce.
Mike Royce, you can write the name of the patient. And only what GP asks the other person, you write down in your own words. Need not be exactly the same wordings. Understand it and write in your own words, or as it is, whatever you want to.
For questions 13 to 24...
Sorry?
We need to write the question up, then
Only
why you ask?
questions. Only the questions asked by the GP you have to write.
Okay, Father.
Yesterday I gave you the questions. Today
Yes,
we
Father.
are going to challenge you to listen and write down the questions. Just the questions. Maybe you can write it brief with the same meaning in your own words, or as it is. Ready?
Yes, Father.
Yes,
Yes,
Father.
yes.
Yes, Father.
Yeah, to YouTube. Are you ready?
Father, how many questions it would be?
That's okay. That as you go on, you'll understand. Don't worry. So put some 10 numbers in 10 lines. Okay?
Okay, Father.
Yeah. Yeah. Right. Shall we go?
Yes, Father.
Yes,
Yes,
Father.
Father.
Yeah.
Mike Royce. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello? Coming in. You must be Mr. Royce. I understand that you've just signed up with the practice.
Yeah, that's right, Mike Royce. I've joined this practice because my previous GP retired and he suggested I come here.
Right, and I understand you've got an ongoing medical condition you're worried about? Perhaps you'd like to start by telling me about that. How did it start?
Well, I suppose...
Exactly like yesterday.
Yeah, Father.
Got it?
Medical condition?
Yes.
Only the
Ongoing medical
Ongoing medical condition.
Ongoing medical
don't
condition.
worry, don't
medical
worry. Don't
condition.
speak out now. Don't speak out. I want everybody to listen. Let them listen. Maybe we'll play one more time. We'll be playing even the response. But whatever, if you find anything, any clue, you can write in front of that question. Okay, question or phrase, whatever. Okay, anything that you presume, you predict could be the answer. Okay, if you have understood the question, for example, here, like yesterday exactly, they are asking, are you suffering from some condition or some illness? You know, they are going to speak a name of a condition will be the answer. So write down that name of the answer as well in front of that question, if you find. Okay. Ready? We'll move once again with that question.
Hello? Coming in. You must be Mr. Royce. I understand that you've just signed up with the practice.
Yeah, that's right, Mike Royce. I've joined this practice because my previous GP retired and he suggested I come here.
Right, and I understand you've got an ongoing medical condition you're worried about? Perhaps you'd like to start by telling me about that. How did it start?
Well, I suppose it started out as a really strong pain in my left knee. In I think it's called the medial meniscus.
Mm-hmm.
Is that right?
Mm-hmm.
It came on whenever I tried to bend the knee more than normal. Then I tripped while climbing some stairs at work, and that seemed to make things worse. I started to get these very tender bumps all over the back of the knee.
Right.
They were very painful, even just lightly touching them. The doctor called them trigger points.
Yeah, that's right. They're called that because pain frequently radiates out from them when touched. And how did that affect you day to day?
Well, I went...
Muted. Father muted.
I muted it because the question is asked. So you have to write down the question, right?
Yes. Done.
Done. I'll play the question one more time. Okay.
touching them.
Yes, sir.
The doctor called them trigger points.
Yeah, that's right. They're called that because pain frequently radiates out from them when touched. And how did that affect you day to day?
Well, I went back to work after a week or so, but I was still having knee problems. I couldn't really squat properly or climb ladders. That's important in my job. I'm a painter, you know, and I'm always having to get into awkward positions. Anyway, I kept going back to my old GP explaining that I still had severe pain whenever I tried to bend my knee. He gave me all these exercises to do, and I tried doing them. I really did. I made sure I did gentle stretches before I did anything more energetic, everything really. I tried resting like he told me. I used ice packs when it got sore, but nothing really worked.
Right, I see.
But then the doctor decided I might be suffering from tendinitis. So he sent me for some rehab work in the hospital. That actually did seem to work, at least at first.
But I'm guessing not for long.
Right. The problem came back. I kept telling the doctor that my knee still wasn't healed, but it was actually my physiotherapist in the hospital rather than my old GP who noticed that something was wrong with my muscles. He wouldn't say what it was, but I knew something was up. He was doing myofascial release on my hamstrings, and I was in agony.
Right, so did you go back to your GP?
I did, but he didn't know what I should do about it, so I left feeling completely fed up. That's one of the reasons I decided to come here.
Okay.
I just feel like nobody's taking this seriously. I think it's affected my life in lots of other ways too. The worry's given me insomnia, for one thing. I don't think I have actual depression, but I certainly suffer from constant anxiety about when it's going to flare up.
Is there anything that you're particularly worried you might have?
Well, I've researched
Got it?
Yes, Father.
Done, Father.
Yes.
when it's going to flare up.
Is there anything that you're particularly worried you might have?
Well, I've researched this pain I'm getting. To be honest, I'm convinced I've got fibromyalgia, not just some simple muscle problem, because I fit most of the symptoms, and I've had pain absolutely everywhere. Look, I've even kept a pain diary so that I could track what I did that set it off. You know, the weather, if I was working or not, where it was affecting me, what it felt like.
Oh, good.
I figured out from this that it's usually in the same places that I mentioned earlier, plus some newish places too. My shoulders and elbows. And I know that my knee's actually one of the more tender points for it. What do you think?
Look, I must say from what you've told me so far that I'm concerned enough to look into that possibility. So as a next step, we need to get you seen by a rheumatologist. This is a notoriously difficult condition to diagnose, as I'm sure you're aware, because so many of the symptoms overlap with other conditions too.
I won't be happy to be proved right, but I'll certainly be glad to get some answers at long last.
Okay. Yeah, got the questions? Can somebody
Ongoing medical condition. How did it start?
Can somebody read out number one, question number one? And what is the clue?
How did
Ongoing
medical condition.
One.
How did it start?
One at a time. Others can join or contribute if they miss something. Anybody one takes the lead.
Yes, Father, I will do.
Anyone?
Tell me about.
Yeah.
Continue.
Okay, the first one is that how did it start regarding the ongoing medical condition, and the second one is that how did
any answer for that?
Medial meniscus.
Medial meniscus.
Yeah. Which part of the question is important?
Strong pain in left knee.
We need to focus the condition.
Yeah.
Strong pain in the left knee.
How did it start?
How it started.
Strong pain in left knee.
Strong pain in left knee.
Yeah. Important question is how did it start? And strong pain in my knee. I think it's called. When a name is yeah, that will be the answer. That may be the answer. Usually, when they say this is the condition I have, severe pain in my knees, and that is called something. When they use that technique, what comes after called, that name will be could be the answer. Could be. We are just predicting. Okay, let's see. So you can write that. What is that? Medial meniscus. Yeah, Sash, you can continue.
Yeah.
Anyone else has got any other option? You can suggest. Okay. Yes. Question 2.
Second one is that how did that affect day-to-day activities.
Louder.
How did that?
You did not have the.
How did that affect day-to-day activities?
Okay. Any clue?
How did that affect?
Squat and walk problem, Father.
Yeah.
Okay.
Father,
He can squat properly
Bending
ladder like
knees,
that.
squat.
Okay.
Tendon bumps, back of the knee, trigger points,
Okay,
climbing, difficulty lower.
let's see. What will be the answer? We'll look into the next. We will be looking into the questions, not the answers. Yeah. Next question. Question number 3.
Did you
It
go
can be a
back to
question or a
GP?
statement, okay? Anything that leads to the answer. Need not be exactly a question. A statement also is cool.
did you go back to your GP?
So further, the pain radiates.
No. Third one. Question I'm asking Sash.
Yeah. Did you go back to GP?
Okay. Answer?
Is they asking for the treatment, Acha?
Okay, let's see. Next one.
Insomnia.
The next one is that anything that particularly worried?
Okay. What is he worried about?
Worried about some.
Fibromyalgia.
Yeah. I am convinced that has something to. Yeah. Cool. Fibromyalgia. Let's see. Next.
Yeah, Acha. Is that one?
That's all. That's all, right?
Yes.
Yes. Now let's look at the questions. Okay. Give me 1 minute so that I can put that in.
Then refer to rheumatologist.
Sorry.
Need to consult with rheumatologist.
Okay. Let me try to put in one page. It is little long. Okay. Okay, cool. I'll have to stop sharing and share again. I'm showing you the questions now. Yes. Can you see the questions?
Yes, Father.
Yes, Father.
13 to 41. Now look at read the questions. Severe 13, question 13. Severe left knee pain in dash area. What could be the answer?
Left
You have to focus on
body part.
Yeah. In area, in one body part. Okay. We'll listen again when you can. Now, next one, 14. Worsened after an accident at work. Developed dash on back of knee. Developed.
Bump.
It could be a symptom, something regarding the.
Developed bump.
Yeah, whatever it is. Then impact on daily life. You know, there was a question about how does it impact your daily life. Unable to dash.
It's activities.
Climb ladders.
Unable to walk.
Unable to do some
Climb ladders.
Activities.
Yeah, okay.
And if you, climbing ladders is there. And, while working, house painter problems, climbing. And, there they mentioned that is my important work, my main work. Initial treatment exercise program, including stretching exercise, rest, dash for pain.
So we need to focus the medications like that, something
Medication. GT suspected dash.
It's a condition.
It's a condition. Prescribed hospital-based rehabilitation. Temporary improvement noted. Current condition. Muscular problem diagnosed by.
Someone like a professional.
Diagnosed by.
Physiotherapist.
Or GP.
Physiotherapist.
Then was performing treatment on.
Condition.
Condition or maybe,
This is what we have to do during the 30 seconds, golden seconds, 30 golden seconds. Then experiencing insomnia and fanboys.
Symptoms, something like that.
Insomnia, depression.
Yeah. Suspects dash.
A condition.
Fibromyalgia.
Has
Fibromyalgia.
recorded experiences in
Dairy.
whatever it is. Just to idea, whatever comes before the gap and after the dash, just highlight and have in mind. Beginning to experience pain in both.
It is a body part.
Body part.
Yeah.
Both.
Suggested course of action. Recommended referral to
Physician or someone.
Referred to rheumatologist.
Okay. Just write
Rheumatologist.
down. Yeah, just now write down questions 13 to 24. Just write down question number line by line. 13, 14, 15, 16, 17, 18, 19, 20, 21, 23, 22, 23, 24. Now multitasking, okay? You will be concentrating on the questions. Reading the questions means passively reading. At the same time, listening to the audio and writing the answers in the thing. You have to look at the screen. You have to listen. You have to write. Multitasking. Listening, reading, and writing. That's very, very important. You need to practice in listening. Subtest. Are you ready?
Yes, Father.
Now you are focusing only on the answer. Okay? Ready? With your smile.
Okay,
Yes.
Father.
Yeah. Ready.
Extract 2, questions 13 to 24. You hear a GP talking to a new patient called Mike Royce. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
During this time, these golden seconds, you have to look at the words before the gap and after the gap. Go through it fast. Highlighted words.
Hello? Coming in. You must be Mr. Royce. I understand that you've just signed up with the practice.
Yeah, that's right, Mike Royce. I've joined this practice because my previous GP retired and he suggested I come here.
Right, and I understand you've got an ongoing medical condition you're worried about? Perhaps you'd like to start by telling me about that. How did it start?
Well, I suppose it started out as a really strong pain in my left knee. I think it's called the medial meniscus.
Mm-hmm.
Is that right?
Mm-hmm.
It came on whenever I tried to bend the knee more than normal. Then I tripped while climbing some stairs at work, and that seemed to make things worse. I started to get these very tender bumps all over the back of the knee.
Right.
They were very painful, even just lightly touching them. The doctor called them trigger points.
Yeah, that's right. They're called that because pain frequently radiates out from them when touched. And how did that affect you day to day?
Well, I went back to work after a week or so, but I was still having knee problems. I couldn't really squat properly or climb ladders. That's important in my job. I'm a painter, and I'm always having to get into awkward positions. Anyway, I kept going back to my old GP explaining that I still had severe pain whenever I tried to bend my knee. He gave me all these exercises to do, and I tried doing them. I really did. I made sure I did gentle stretches before I did anything more energetic, everything really. I tried resting like he told me. I used ice packs when it got sore, but nothing really worked.
Right, I see.
But then the doctor decided I might be suffering from tendinitis. So he sent me for some rehab work in the hospital. That actually did seem to work, at least at first.
But I'm guessing not for long.
Right. The problem came back. I kept telling the doctor that my knee still wasn't healed, but it was actually my physiotherapist in the hospital rather than my old GP who noticed that something was wrong with my muscles. He wouldn't say what it was, but I knew something was up. He was doing myofascial release on my hamstrings, and I was in agony.
Right, so did you go back to your GP?
I did, but he didn't know what I should do about it. So I left feeling completely fed up. That's one of the reasons I decided to come here.
Okay.
I just feel like nobody's taking this seriously. I think it's affecting my life in lots of other ways too. The worry's given me insomnia, for one thing. I don't think I have actual depression, but I certainly suffer from constant anxiety about when it's going to flare up.
Is there anything that you're particularly worried you might have?
Well, I've researched this pain I'm getting. To be honest, I'm convinced I've got fibromyalgia, not just some simple muscle problem, because I fit most of the symptoms, and I've had pain absolutely everywhere. Look, I've even kept a pain diary so that I could track what I did that set it off. You know, the weather, if I was working or not, where it was affecting me, what it felt like.
Oh, good.
I figured out from this that it's usually in the same places that I mentioned earlier, plus some newish places too. My shoulders and elbows. And I know that my knee's actually one of the more tender points for it. What do you think?
Look, I must say from what you've told me so far that I'm concerned enough to look into that possibility. So as a next step, we need to get you seen by a rheumatologist. This is a notoriously difficult condition to diagnose, as I'm sure you're aware, because so many of the symptoms overlap with other conditions too.
I won't be happy to be proved right, but I'll certainly be glad to get some answers at long last.
Okay.
Yes, Father.
Yeah, number 1, 13. Question number 13. What was the answer?
Medial
Medial meniscus.
Meniscus. Okay. Medial meniscus. 14.
Tender bumps.
Tender bumps.
Tender bumps or bumps, anything is cool.
Bumps.
Or painful bumps.
Only.
Painful bumps also is right. Tender bumps right. Just only bumps is also right. Tender bumps also is right. Painful bumps also is right. Tender painful bumps also is right. Okay. Adjectives are usually allowed with the answer. Please mute. Please mute. Yeah. If you have distraction and second instrument, please lower the sound because my sound is echoed again. Because at the YouTube live stream, it comes after a few seconds. Okay. Yeah. Question 15.
Squat.
15.
Squat. Unable to
Squat properly.
Unable to squat.
Squat.
Okay, squat properly. Or yeah. Then 16.
Ice
Ice
pack.
pack.
Ice pack or ice packs or used ice pack or used ice packs. All these are good. 17.
Tendinitis.
Exactly. 18.
Physiotherapist.
Physiotherapist. Exactly. Then 19.
Hamstring.
Hamstring or hamstrings. Both are right. 20.
Anxiety.
Anxiety. Right. Or constant anxiety. That's also right. 21.
Fibromyalgia.
Fibromyalgia. 22.
Pain diary.
Pain diary.
Pain diary or pain diary is right. Pain diary is right. If you write just diary, that's also right. Okay. Okay. 23.
Shoulder and elbows.
Yeah. Shoulders and elbows. Or elbows and shoulders, if you write, both are right. Or his shoulders and elbows also is right. Okay. 14th.
Rheumatologist.
Yeah. Excellent. You got all the answers. Right? Now, with this in mind, listen one more time. Okay? You have stamina, right?
Yes.
Yeah. This, why will you listen again? Because you should know how it connects. What are the words or synonyms they are using? And write down the synonyms if you can find out. Okay? Instead of severe left knee pain, they have said something else. So if you can find any severe or synonyms or synonymous, what is given in the notes here, you can see on the screen, right? The notes, patient notes. Those are the questions. Just see if you can identify. If you can write down some of them at least, please write down the synonymous expressions used in the audio in the place of expressions, something else used, some other words used in the patient notes, or what you call the questions 13 to 24. Ready?
Yes, sir.
Yes.
Keep looking at the questions also, okay? What is seen on the screen.
Extract 2, questions 13 to 24. You hear a GP talking to a new patient called Mike Royce. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Please mute. Those who have distractions, please mute.
Hello? Coming in. You must be Mr. Royce. I understand that you've just signed up with the practice.
Yeah, that's right, Mike Royce. I've joined this practice because my previous GP retired and he suggested I come here.
Right, and I understand you've got an ongoing medical condition you're worried about? Perhaps you'd like to start by telling me about that. How did it start?
Well, I suppose it started out as a really strong pain in my left knee. In I think it's called the medial meniscus. Is that right?
Mm-hmm.
It came on whenever I tried to bend the knee more than normal. Then I tripped while climbing some stairs at work, and that seemed to make things worse. I started to get these very tender bumps all over the back of the knee.
Right.
They were very painful, even just lightly touching them. The doctor called them trigger points.
Yeah, that's right. They're called that because pain frequently radiates out from them when touched. And how did that affect you day to day?
Well, I went back to work after a week or so, but I was still having knee problems. I couldn't really squat properly or climb ladders. That's important in my job. I'm a painter, you know, and I'm always having to get into awkward positions. Anyway, I kept going back to my old GP explaining that I still had severe pain whenever I tried to bend my knee. He gave me all these exercises to do, and I tried doing them. I really did. I made sure I did gentle stretches before I did anything more energetic, everything really. I tried resting like he told me. I used ice packs when it got sore, but nothing really worked.
Right, I see.
But then the doctor decided I might be suffering from tendinitis. So he sent me for some rehab work in the hospital. That actually did seem to work, at least at first.
But I'm guessing not for long.
Right. The problem came back. I kept telling the doctor that my knee still wasn't healed, but it was actually my physiotherapist in the hospital rather than my old GP who noticed that something was wrong with my muscles. He wouldn't say what it was, but I knew something was up. He was doing myofascial release on my hamstrings, and I was in agony.
Right, so did you go back to your GP?
I did, but he didn't know what I should do about it. So I left feeling completely fed up. That's one of the reasons I decided to come here.
Okay.
I just feel like nobody's taking this seriously. I think it's affected my life in lots of other ways too. The worry's given me insomnia, for one thing. I don't think I have actual depression, but I certainly suffer from constant anxiety about when it's going to flare up.
Is there anything that you're particularly worried you might have?
Well, I've researched this pain I'm getting. To be honest, I'm convinced I've got fibromyalgia, not just some simple muscle problem, because I fit most of the symptoms. and I've had pain absolutely everywhere. Look, I've even kept a pain diary so that I could track what I did that set it off. You know, the weather, if I was working or not, where it was affecting me, what it felt like.
Oh, good.
I figured out from this that it's usually in the same places that I mentioned earlier, plus some newish places too. My shoulders and elbows. And I know that my knee's actually one of the more tender points for it. What do you think?
Look, I must say from what you've told me so far that I'm concerned enough to look into that possibility. So as a next step, we need to get you seen by a rheumatologist. This is a notoriously difficult condition to diagnose, as I'm sure you're aware, because so many of the symptoms overlap with other conditions too.
I won't be happy to be proved right, but I'll certainly be glad to get some answers at long last.
Okay, now, are you still here?
Yes.
Yes,
Any synonymous expressions? So if you
Yes.
have the hard copy, always when you listen to, try to write down the synonyms and synonymous expressions on the hard copy. Okay. Yes. Tell me.
Father,
So the first one is the strong pain
Severe,
instead of severe
strong,
activity. Strong pain in my
severe,
What?
strong,
severe, like strong, develop. There is a
Yeah.
started
Okay.
and
impact, effect,
Effect.
and there
Okay.
is pain. For pain, there is sore.
pain, sore,
Yeah.
And, suspected, decided.
suspected, notice,
started.
No. First one,
developed.
GP suspected, decided.
Okay.
And after that, diagnose.
Instead of
OET
the
experience.
19th one.
Then further there is a diagnose by, then noticed,
Okay.
and then
the
treatment
19th one.
on, do on.
Okay.
Instead of the
And
treatment,
giving
I
me
noticed that they said
experiencing
myofascial release.
Insomnia, giving me insomnia.
Yeah.
And suspected, worried, suspects worried.
Yes.
And after that, recorded,
I even
track,
kept a pain diary. Even
and
kept a recorder like that. It kept a pain diary.
Okay.
pain in both, beginning to experience pain in both newish place.
Newish place. Okay. Newish place means new place.
New place. Yeah.
Okay, that's cool. Now, can you identify what are how many names are there? Medicine or condition or diagnosis test?
Body part is
Body part, yes, body part.
Body part,
Name of your body
activities.
part, name of your condition, name of your drug, name of a what you call
Activities is there.
Just try count down how many names are used as answers.
Physiotherapist,
And symptoms.
Yeah, designation.
Fibromyalgia, tendonitis.
Total how many? Just count how many total.
Acha, the
And body
19th
part
one,
video
acha.
minister.
Acha,
Yeah, please.
19th one, in the audio, they said that instead of the treatment, what is that? Myofascial release.
Okay.
And the answer is that hamstring. Like that.
Okay.
Hamstring or hamstring.
Now, just can somebody type in those words maybe those words in the questions for which you found the synonyms. Don't give the synonyms. Only the questions what you mentioned just now. The words, just the words. Somebody can announce, or someone else can type in for the people at YouTube. No, just type in the comment space, because some have got doubts about the synonyms and synonymous expressions. So just tell us what are the words in the question. Maybe it's a question number and the word or phrase. For example, somebody said suspected was like worry or whatever. Yeah. Number 13. Any synonyms for any word?
Yeah, severe.
For severe.
Severe, that is strong. Strong.
pain.
Strong pain.
Yeah, just write down severe. Somebody type it in the, yeah. Somebody can keep typing in the comment space. Total all together you can put it. Just the word severe. Next one. 14th one. Any synonyms you found?
Developed, like in the audio
Developed.
started.
Okay, developed. 14th one. 15th one, unable to. Was there any synonymous expression?
Yeah, couldn't
Yeah,
properly.
couldn't.
Okay. Just write down. Okay, everybody write down. Unable to. First one was severe. Second one, 14th one, developed. 15th one, unable to. 16th one, anything?
Sore, for pain, sore.
Okay. For pain, there was something. So write pain. Then 17th one, suspected. Was there a synonym?
Worried.
Okay,
No.
whatever. We are not bothered. We'll listen one more time just to identify those synonyms and write down. Just write down these diagnosed by. Just write down 18. 19th treatment on. 20th experiencing. Was there something synonymous?
Yeah. Experiencing.
21 suspects. 22 recorded. There was some synonym, I believe. Just listen to that.
Yes.
Yeah. Then 23 experience. Maybe. 24 recommend or referral.
Recommended.
Okay. Now you have to write down, as you listen, you have to just write down the synonyms or synonymous expressions of these words which you have written down. Okay. You have stamina for 2 more minutes.
Yes, Father.
Yes. With a smile. Okay. Now you are focusing on the synonymous expressions. Look at the screen or the words that you have written down. That will be cool. Just look at the words that you have written down. Listen. Read the words you have written down. And write the synonyms or synonymous expression. Yes.
Extract 2. Questions 13 to 24. You hear a GP talking to a new patient called Mike Royce. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Read those words which you have written down. 12 words.
Hello? Coming in. You must be Mr. Royce. I understand that you've just signed up with the practice.
Yeah, that's right, Mike Royce. I've joined this practice because my previous GP retired and he suggested I come here.
Right, and I understand you've got an...
Pause.
Sorry, I'll play again.
Pardon my voice.
Yeah, power failed. I'm playing it again, okay? Yes. Distractions, please mute. You can't hear, right?
Is that right?
Now here.
Perhaps you'd like to start by telling me about that. How did it start?
One more time. Listen from the beginning, yes.
Hello? Coming in. You must be Mr. Royce. I understand that you've just signed up with the practice.
Yeah, that's right, Mike Royce. I've joined this practice because my previous GP retired and he suggested I come here.
Right, and I understand you've got an ongoing medical condition you're worried about? Perhaps you'd like to start by telling me about that. How did it start?
Well, I suppose it started out as a really strong pain in my left knee. I think it's called the medial meniscus.
Mm-hmm.
Is that right?
Mm-hmm.
It came on whenever I tried to bend the knee more than normal. Then I tripped while climbing some stairs at work, and that seemed to make things worse. I started to get these very tender bumps all over the back of the knee.
Right.
They were very painful, even just lightly touching them. The doctor called them trigger points.
Yeah, that's right. They're called that because pain frequently radiates out from them when touched. And how did that affect you day to day?
Well, I went back to work after a week or so, but I was still having knee problems. I couldn't really squat properly or climb ladders. That's important in my job. I'm a painter, and I'm always having to get into awkward positions. Anyway, I kept going back to my old GP explaining that I still had severe pain whenever I tried to bend my knee. He gave me all these exercises to do, and I tried doing them. I really did. I made sure I did gentle stretches before I did anything more energetic, everything really. I tried resting like he told me. I used ice packs when it got sore, but nothing really worked.
Right, I see.
But then the doctor decided I might be suffering from tendinitis, so he sent me for some rehab work in the hospital. That actually did seem to work, at least at first.
But I'm guessing not for long.
Right, the problem came back. I kept telling the doctor that my knee still wasn't healed, but it was actually my physiotherapist in the hospital rather than my old GP who noticed that something was wrong with my muscles. He wouldn't say what it was, but I knew something was up. He was doing myofascial release on my hamstrings, and I was in agony.
Right, so did you go back to your GP?
I did, but he didn't know what I should do about it, so I left feeling completely fed up. That's one of the reasons I decided to come here.
Okay.
I just feel like nobody's taking this seriously. I think it's affecting my life in lots of other ways too. The worry's given me insomnia, for one thing. I don't think I have actual depression, but I certainly suffer from constant anxiety about when it's going to flare up.
Is there anything that you're particularly worried you might have?
Well, I've researched this pain I'm getting. To be honest, I'm convinced I've got fibromyalgia, not just some simple muscle problem, because I fit most of the symptoms, and I've had pain absolutely everywhere. Look, I've even kept a pain diary so that I could track what I did that set it off. The weather, if I was working or not, where it was affecting me, what it felt like.
Oh, good.
I figured out from this that it's usually in the same places that I mentioned earlier, plus some newish places too. My shoulders and elbows. And I know that my knee's actually one of the more tender points for it. What do you think?
Look, I must say from what you've told me so far that I'm concerned enough to look into that possibility. So as a next step, we need to get you seen by a rheumatologist. This is a notoriously difficult condition to diagnose, as I'm sure you're aware, because so many of the symptoms overlap with other conditions too.
I won't be happy to be proved right, but I'll certainly be glad to get some answers at long last.
Sorry, I'm not audible. You are not telling me. I was continuously speaking. Okay. Now, what I was saying was just this one. You can post the synonyms in the main platform after the session so that everybody can benefit from each other. If there is corrections, you can find the corrections from each other so that we don't spend much time here. Another important thing, description of initial symptoms. Okay. So here, what are the answers? First one, 13th one.
OD parts.
Really strong.
Huh?
Medial meniscus.
Medial
Okay.
meniscus. Medial
Then 14th
meniscus.
one. 14th one.
Tender bumps.
Bumps.
Okay. 15th one.
Squat properly.
Okay. So symptoms, description of initial symptoms is important here, right? So you have to look at the headings, side headings. Initial treatment is important. Initial treatment. Then developments in condition, developments is important. What are the developments? Then current condition you have to focus on. Okay. Then suggested course of action, referral. Next step, they say next step, right? This is the way you need to practice and try to listen to it as many times as possible. That will help you. Okay?
Father, I didn't hear this 18 muscular problem diagnosed by physiotherapist. I didn't hear 2 to 3 times I listened.
That was clearly stated physiotherapist.
Rather than GP.
Hmm?
I will hear again, Father.
Yeah, we will. I'll send you I'll be sending it in the main platform.
Yes.
Okay, the audio and the details like yesterday. I'm doing it now itself. One sec. So that you can listen again. Let me check.
Father, that is arm sling or hamstring? Answer.
Hamstring.
Hamstring.
Arm sling or hamstring?
Hamstring. I think it's hamstring.
Spell out. Somebody spell out, please.
I think it would be HARMSTRING. I think so. I'm not sure.
Yes, that is hamstring.
No, HAM.
Which one? It is HAM string. STRING. HAM STRING.
I write in the chat box.
I'll show you the screen. I will show you the screen. Don't worry if you have doubts. One sec. Sorry, I'll have to stop and share, then you can see.
Yes, Father.
It's good you asked such doubts so that. Can you see the screen?
Yes, Father.
Yes, Father.
Yeah. Medial. Sorry. See medial meniscus. Don't worry about the over there. Confusions. Squat, whatever I have highlighted in green, just look at that. That is enough. Ice packs. 16 tendinitis. 17.
Father,
Yes.
Father, if in 13 instead of E I write I, and rheumatologist I didn't wrote U, and tendinitis I didn't write like O instead of O I write I. So these mistakes will be.
These mistakes will be penalized because if you write tendinitis instead of O, if you write the pronunciation will become tendinitis, and it's a name of a medicine, a condition, and you should spell it correctly. And if the minor spelling mistakes should not change the pronunciation or meaning. Now, if you write I instead of O, that changes the pronunciation and meaning. So definitely you will be penalized. You are supposed to know the spelling of tendinitis because you are a health professional, right? Yes. Physiotherapist. Physiotherapist, even if you write physio, that is considered right, but physiotherapist, you can write, it's clearly said there. Hamstring or hamstrings. Constant anxiety or anxiety, both are right. Fibromyalgia. Pain diary, or whatever you write, even if you write just diary, cool, Shoulders and elbows. What I have highlighted in green. Okay, you are seeing my screen, right?
Yes,
We
Father.
have to write shoulders and elbows. Yes, we have to put our shoulder and elbow. We can write.
Shoulders and elbows. You can't write shoulder because normally they are used in plural.
Okay.
Shoulders and elbows. If you say shoulder only in one shoulder, you have pain, right?
Okay.
If I say I have pain in shoulders, both the shoulders, you can't say he has pain in shoulder. He has pain in the shoulders and elbows. It must be plural. Otherwise, the answer will be in right elbow or right shoulder or left elbow, left shoulder or right shoulder. That will be mentioned.
Father, I think if there is a single, if there is plural word and we will write singular, it will be penalized, right?
It depends. For example, hamstring or hamstrings, both are right. But then shoulders, if you write singular, there you'll be penalized.
Okay.
Because he has got problem in both his shoulders and elbows, not one elbow or one shoulder.
And Father, there is a tendonitis. We have to capital letter of T or a small letter of T can be okay.
Tendonitis is capital letter T because it's a proper noun, right? Fibromyalgia, F must be capital. Rheumatologist, R must be capital. Whereas other things, shoulders, diary, all these can be small letters. Proper nouns, designations usually start with capitals, uppercase letters. You are able to see my screen, right? With all the answers highlighted with green?
Yes,
Okay.
Father.
Okay. Right.
Aja, is there any issue if we write in the small letters?
Normally you are supposed to, there is issue. Tendonitis, you cannot write in small letters. Like Saline, my name, you can write with the small letters, right?
Okay. Okay.
Can you write?
Yes,
Sash, can I write with small letters? S?
No.
No, that's the normal thing. It has to be capital, uppercase letters. But sometimes what people do is a gymnastic. They write all the letters, all the words, all the spellings in capital. Then it is cool. But if you are using that, you have to use it for all the answers, not one answer. Do you understand? Squat, you can write all the SQAT in uppercase letters or capital letters. No problem.
If there is all capital letters, it's okay, Father?
It's okay.
Okay.
Father, what if mistakenly we write squat with climbing? So this would be a mistake, like they will cut our marks.
Yeah,
Squat with
definitely.
climbing.
Definitely. Because climbing is already there, right? Let me check. It is there, right?
Yes, Father.
Yes, Father.
Yeah,
It is
you
there.
can't repeat. Yeah, then you can't repeat it. Climbing is here. Unable to squat. That becomes doubling. Whatever, when you fill in the gaps, for example, when you write a test, blood test, after the gap, test is given. So answer is blood. If you write answer as blood test, that is wrong. Because when you read, it becomes blood test, right?
Yes.
So that is wrong. Normally, there is no change. Exactly the same words have to be written in the gap. Whereas other expressions will be paraphrasing or synonyms and synonymous expressions. But answer will never be a synonym. Answer will be exactly what you hear. No synonyms. But all other things will be given in synonyms and synonymous expressions. That's why I ask you to keep the diary and write all these synonyms and synonymous expressions.
Acha,
Yes.
if you write the small letters like are they cutting the mark also, right?
Yeah, proper nouns, medications. If you write
Designations like that.
designation, if
Physiotherapist.
you write small letters, they will penalize. That's not proper, right? See, proper nouns anywhere in between the sentences in the gaps, it must start with uppercase letter. You write our teacher Saline Joseph. S and J must be uppercase, right? Capital letters. It doesn't matter whether the sentence begins with it or it comes in between, wherever. So always try to write proper names. What you call, even in your writing, the same rule applies. But then don't worry. If you are not sure whether it's a tendonitis, all the conditions you know. If you are not sure about one answer, don't worry. Smile and write whatever you feel, because you need only 450. 50 marks is allotted for the examiner. Okay. Yeah, smile and say, you have to smile and tell yourself, okay, 450 is cool for me, so let it go. Okay.
We can get 450.
Definitely, why not? I wonder why these people have given 350 so low a mark as the qualifying grade or mark. They should have given at least 400. 350 is too low out of 500. Right?
I hope we will get.
Yeah, definitely you can. There are people who have got 450, 460. We have in our own platform people who have got it. Why not? Even if you miss 2 or 3 or 4 answers, you can get 450 or 460. If you practice with patience, enjoy, in love with OET, you can. And you can. Once you get all these tricks, you know. Now tell me, how many names are there? Whatever the names, designation, condition, or test. Say.
Name 2 physiotherapist and rheumatologist. Condition is a tendonitis, fibromyalgia, and part of the body is the medial meniscus, the shoulder and elbow, and things are the ice pack.
Activities, scout properly.
Yeah. Diary. But there are so many names, you know. Names is a very, very important criteria when listening and reading. That's why we are running with names. That's why we focus on names. That analytical thinking you must get. Okay. Now later on, you should be able to analyze these questions, no? You should be able to see the questions, write down the questions and find out what will be the answer. And side headings, description of initial symptoms. If you know the condition, what are the symptoms? Even before you can't see that, right? One sec. I'll show you. Where is it? See this one, you can see this Word document, right? Is it visible?
Yes, sir.
Yes,
yeah.
Father.
Now you have to keep understand from the initial introduction what is the condition. Okay. Then description of initial symptoms. Just foresee or predict, speculate what could be the symptoms. Then the initial treatment. What could be the treatment? Developments in condition. What can worsen or go bad? Current condition. Just imagine what could be. Suggested course of action. Those are the side headings. What I said, highlighted side headings. Try to presume and write down something. May not be right or all right. Even if you make a mistake there in your presumption, when you listen to, you understand better. Because okay, I thought something else. I was wrong. This is right. That helps your listening skill. If you have a suspicion, doubt about anything, you will listen more attentively. It has got a psychological impact. Right?
Right.
When you are suspicious of some pitch holes in the road, you'll be more conscious when you ride, right? So when you have some doubts, you'll be more attentive. Please mute. Please mute. Please mute. You can hear your own sound, right? Then why don't you realize that? If your headphone is in your ears, yes.
Father, there is a condition, diagnose, and names, and what else we should write in the capital?
Only proper nouns, conditions, names of the conditions.
Okay.
And the what you call it? I don't know. The brand names, medications.
Okay.
Medications, brand names you have.
Okay.
You call it brand names, right?
Yes. Brand.
Yeah, those things must be in capital.
Okay. Thank you, Father.
You're most welcome. I think that is it. Anything else? Cool. It's more than enough.
Father,
Yes.
To say first letter in capital only. First letter.
Only first letter. No. What I said is sometimes you can write all the letters in capital. No issue. You'll not be penalized. All the answers in capital. If you are doing it, do it for all the answers. But you can definitely go with normal, like Saleen. S is capital ALEEN. So that's cool.
Okay.
Don't get tense about those small things.
Okay,
That's why I
Father.
said 450 is enough. I will not scold you for not getting 500. So don't get unnecessarily tensed about those things. Those issues will not happen. Okay. And as we go on with listening, now we are in reading, right? Episodes are going on. So that's why I'm clubbing and showing you how names are important everywhere. You know, if you remember when I taught you reading and listening, I said what you have to listen for or what you have to skim for. And that name was one. And if you remember, I have given name of condition, organ, body part, all those, the designation, so many things. So that's what we are practicing now. But then when you come to listening, I'll be giving you every bit of it. Don't worry. Okay? Every bit of it. This is in general, just to give you arouse your curiosity. But beautiful, like, I don't know whether you enjoy it. I enjoy it.
Yeah, we
Yes, I
enjoyed.
really enjoyed.
Yeah.
Thank you for your constant support,
Wow,
sir.
enjoying
Because
every
you're
day
doing
new.
great.
You're
Because
most
like in all
welcome.
of the institute, like you're focusing the the cash, but you're not you're entirely different, sir. You're
Yeah, only I
supporting
am
each other. Thank you. So
yeah,
thanks
my
for
concern
this.
is that very few people benefit from it. Well, how could reach to maximum people? You know, people don't no health professional require any other training if they really come here and go along. Okay, as we are putting everything step by step, it will be cool. Even without any sessions, also you can pass. Like no, sometimes even episodes and all it looks odd, but then it is
Father,
very
can I ask something?
yeah.
Father, it's out of topic. Is that okay?
Out of
Out of topic, like not listening.
no, you have to keep the phone. That was my instruction. So phone somewhere because it irritates on litters and sit properly. You have to keep the
Father,
phone stable. Anu, you are not at all obeying my instructions. Okay, you have to, ma, because we are wasting the time of everybody, right? Now you are
I'm in the
unnecessarily walking.
road.
Yeah, why should you walk now? Why should you walk now? See,
I'm
even that
going back
respect
to hostel. I'm
hostel.
sorry,
Okay.
Father. I'm sorry.
Yeah, it's okay. Some or other, like, you know, when you interact, you should be sitting somewhere stable. Otherwise, don't interact. You can, you can post there in the YouTube comment space. Okay. That's why I said in the Zoom, only when you are available, please enter Zoom. That's why we are connecting with YouTube stream. Otherwise, we never used to connect with others' request. Okay, so that no distractions. Those who are working, those who are traveling can definitely attend via Zoom, right? Via YouTube Live. Thank you, Ms. Everest, for your super chat. Yes. I don't know, Ms. Everest, that's the name, but she or he, Mr. I think, is a constant support with the super chats every day. Thank you. Thank you so much. I don't know the person, I believe. Yeah. Anu, don't feel bad, okay? This is the principle we have made so that there is no distractions for everyone. You can put your doubts in the YouTube comment space. You can just type in. I will answer. Okay. Because you see, when you see me, you can understand better. If I mute and speak, will you be able to understand?
No.
No, Father.
Like, you just listen to it, it will not be that easy. When you see my expression, smile, it's also when you speak, sometimes you are not asking the question in a question format. Okay. So I have to understand, right? So at least for your expressions, we can understand something. Yes.
So
Cool.
once again, thank you very much for your
Yeah,
constant
you're
support.
most welcome. Most welcome. Okay, so that try to share with other people because we are spending so much time, so it reaches maximum people. God bless you all.
Thank you so much, Father.
Yeah, yes, and I will still share something, at least one sentence in the one learning in the main platform, so that somebody will be reminded there is a session. Okay, and tell them also with that message there is a session every day at 8:30. Don't miss it. Something of that sort. So somebody gets invited. Tell them it's in YouTube streaming as well as Zoom Classroom, and Zoom link will be given in the YouTube comment space. That much you can mention there. So those things, if you mention, I can type shorter notices and send. Yes, because people are keep on asking me whether WhatsApp give me Zoom link, give me Zoom link. I can't respond to everyone, right? So in between, when you go to the main platform, just tell them today. Just a reminder, gentle reminder. Today there is a session, discussion and session at 8:30 p.m. Zoom link, YouTube live link will be shared here. And Zoom link will be given at the YouTube comment space. Please join YouTube live link. Something of that sort, whatever in your own way. Today, God bless you. It's a wonderful session. Thank you. Thank you. Yeah, thank you, everybody. Anybody wanting to get a super chat, get it and go. God bless you all. Okay. Yeah, enjoy the journey. God bless you. Yes, Doctor.
Thank you so much,
Yeah,
Father.
God bless you. God bless you. Bye-bye.
Thank you, Father. God bless you.
Thank you.